Welcome to our deep dive into recurrent inguinal hernias.
Oh, hernias.
Yeah, hernias. Now, you might be thinking, hernias, that doesn't sound too exciting.
All right.
But trust me, this topic is full of surprises.
Okay.
We're going to uncover what makes some people more prone to this issue, why the type of surgery matters so much,
Yeah.
and even explore some cutting-edge research that might change how we approach hernias altogether.
It's fascinating, I think, because we're not just talking about like a simple medical condition.
Right.
We're delving into this intricate interplay between your body,
Yeah.
lifestyle choices, surgical techniques, and even genetics.
Okay, so before we get into the nitty-gritty, let's make sure we're all on the same page.
Okay.
Can you give us a quick refresher on what an inguinal hernia actually is?
Absolutely. An inguinal hernia happens when a portion of your intestine
Okay.
pushes through a weak spot in your abdominal wall down in the groin area. It's like a little pocket forming where it shouldn't be.
Okay, got it. So we know these hernias can be repaired,
Right.
but what makes them so tricky is that they can come back, right?
Absolutely.
How often does that actually happen?
You're right. Recurrence is a real challenge with inguinal hernias.
Right.
Even after a first repair,
Mm-hmm.
there's a chance the hernia could return.
Okay.
We're talking about recurrence rates between 0.5% to 15%,
Wow. Okay.
depending on the type of repair used.
Okay, so there's already a chance it could come back
Yeah.
even after the first surgery.
Mhm.
But what about when it's already recurred once? What are the odds then?
That's where it gets really interesting and a bit more concerning.
Okay.
For those who've already had a hernia come back once, the recurrence rate jumps up to 20%. That's a significant increase.
Right.
And it really highlights why this deep dive is so important.
Wow, 20%. That's a pretty big jump.
It is.
So let's unpack why these recurrences happen.
Sure.
Is it just bad luck? Or are there specific things that make someone more likely to have a hernia return?
There's definitely more to it than just luck.
Okay.
A number of factors come into play,
Mm-hmm.
and we could break them down into two main categories,
Yes.
patient factors and technical factors.
Okay, let's start with the patient factors.
True.
What about a person's own body or lifestyle choices makes a difference here?
Well, things like smoking, age, and even conditions like diabetes
Mm-hmm.
can increase the risk of recurrence.
Okay.
These factors can affect how well your body heals
Yeah.
and how strong the tissues are after surgery.
So those are all things that make sense.
Right.
But you mentioned genetics earlier.
Yeah.
Can our family history really make us more prone to hernias?
It might sound surprising, but yes,
Okay.
genetics does play a role.
Interesting.
Studies have shown that a whopping 44% of people who have multiple hernia recurrences
Wow.
actually have a family history of hernias.
Wow, that's a pretty strong link. So it's not just about our lifestyle. It's
Mhm.
literally in our genes.
It can,
That's wild. Okay, so we've covered things related to the patient themselves.
yes,
What about these technical factors you mentioned?
yes,
I'm guessing that has to do with the actual surgery?
you got it. The way the initial hernia repair is done can significantly influence whether it comes back or not.
Mm.
There are a lot of details involved,
Yeah.
from the materials used
Okay.
to the specific techniques the surgeon employs.
So walk me through some of these details. What are the big decisions that are made during that first surgery
Sure.
that could affect whether a hernia comes back?
One of the biggest choices is whether to use sutures or mesh to repair the hernia.
Okay.
A suture repair is essentially stitching the weakened tissue back together,
Okay.
while a mesh repair involves using a synthetic mesh to reinforce the area.
Okay, so sutures are like sewing it closed,
Exactly.
and mesh is like adding a patch for extra strength.
You got it.
Intuitively, it feels like the mesh would be stronger, right?
You're on the right track,
Okay.
and the research backs that up. Studies, especially one from the Swedish Hernia Registry,
Okay.
have shown that suture repairs tend to have a higher rate of recurrence
Yeah,
compared to mesh repairs.
that makes sense.
Yeah.
Okay, so mesh is a key factor.
Mm-hmm.
But is it as simple as mesh good, sutures bad?
Well, no, not necessarily.
Okay.
Are there other nuances within the mesh repairs themselves that could influence outcomes? Absolutely.
Yeah.
It's not just about using mesh, it's about using it correctly.
Right.
Things like the tension on the tissues during the surgery,
Okay.
the size and placement of the mesh,
Yeah.
and even the type of anesthesia used
Oh.
can affect how well the repair holds up over time.
So even seemingly small details during the surgery can make a big difference in the long run.
Absolutely.
That's kind of amazing, but also a bit intimidating if you're
Okay.
facing this surgery.
Yeah.
It makes you realize how important it is to have a skilled surgeon, right?
Get the nail on the head.
Okay.
And we can't shy away from the fact that a surgeon's experience, especially with certain advanced techniques like laparoscopy,
Yeah.
does have an impact on recurrence
That
rates.
makes total sense. Experience matters in any field,
Absolutely.
but especially when it comes to something as delicate as surgery.
Right.
So finding a surgeon who's done a lot of these repairs,
Yeah.
especially using minimally invasive techniques,
Yeah.
is something patients should definitely consider.
Absolutely.
Okay, so we've covered a lot of ground already.
We have.
Patient factors, surgical techniques.
Hmm.
But there's another piece of the puzzle here, right? Where these recurrences actually happen.
Yes.
Like, is it always in the exact same spot as the original hernia?
That's a great question. Not all hernias are created equal,
Okay.
and the location of the recurrence is often linked to the original repair method. For example, hernias can be classified as direct, indirect, or femoral,
Okay.
depending on their location in the groin area.
Got it.
And it turns out that open repairs tend to be associated with more direct hernias, while laparoscopic repairs are linked to more indirect hernias.
So the first surgery can actually influence where a potential recurrence might happen.
It certainly can.
It's like the body is responding to what was done before.
It's adapting.
That's fascinating.
It is.
But it also makes choosing the right surgery the second time around even more crucial, right?
Absolutely.
Because you have to take into account what was done the first time.
Exactly. And that's where the principles of recurrent hernia repair come into play.
Okay, I'm intrigued.
Yeah.
Tell me more about these principles. What's the guiding philosophy when it comes to fixing a hernia that's already come back once?
Well, the first principle is pretty straightforward. Mesh is king.
Okay.
Almost all recurrent hernia repairs
Mm-hmm.
should use mesh reinforcement.
Okay, so we're doubling down on the importance of mesh.
Yes.
We already talked about how it's generally better than sutures, but why is it especially important for recurrences?
Because it drastically reduces the risk of having yet another recurrence. We're talking about a reduction of 75%,
Wow.
which is huge.
Okay.
Studies from the Danish hernia database really solidified this point,
Right.
showing significantly lower recurrence rates when mesh is used.
Wow, those are some impressive numbers.
They are.
It's clear that mesh really makes a difference.
Yeah.
So what's principle number 2? What else do surgeons focus on when tackling a recurrent hernia?
The second principle is all about finding what surgeons call the pristine plane.
Pristine plane. Okay, that sounds intriguing, but a little cryptic.
Yeah.
What does that actually mean?
It means operating in undisturbed tissue,
Okay.
which is especially important after a previous mesh repair.
Right.
Think of it this way. If you were painting a picture,
Yeah.
you'd want a clean canvas, right?
Yeah.
You wouldn't want to paint over old, dried-up paint.
Right. Okay.
It's the same idea in surgery.
Ah, that makes sense.
Right.
So it's about finding an area that hasn't been disrupted by previous surgery, giving the new repair the best chance of taking hold.
Yes.
It's almost like surgical artistry.
Exactly. And when you combine those two principles, mesh reinforcement and operating in a pristine plane,
Okay.
you can start tailoring the surgical approach
Mm-hmm.
based on each person's unique situation.
Okay, so it's getting even more personalized now.
It is.
What are some of the factors that go into deciding the best approach for a particular patient?
Well, we look at things like the location of the previous repair
Okay.
and what type of repair it was.
Yeah.
For example, if someone had a prior repair in the back of the abdominal wall,
Mm.
we call a posterior repair,
Okay.
we'd likely recommend an anterior approach this time,
Okay.
which means operating from the front.
So if they went in from the back before, go in from the front this time.
Exactly.
That makes sense. Kind of like attacking the problem from a different angle.
Precisely.
Yeah.
And there are specific techniques for this,
Yeah.
like the Lichtenstein technique, which is a common open surgery approach.
Right.
But if the first repair was already an anterior approach,
Okay.
we might opt for a posterior approach this time.
Okay, I'm seeing the pattern here. Switch it up based on what was done before.
Exactly.
And I'm guessing laparoscopic techniques would be a good option for those posterior approaches.
You're catching on quickly.
All right.
Laparoscopic techniques,
Okay.
like TEPI or TEPI-PP,
Right, yeah.
are often preferred for posterior repairs because they're minimally invasive,
Yeah.
meaning smaller incisions and generally a faster recovery.
Right.
But let me explain those acronyms a bit more
Yes, please.
so they're clear.
I was about to ask what TP and TPP stand for.
Sure.
They sound pretty technical.
They are, but I'll break them down.
Okay.
TEPI stands for Total Extraperitoneal Repair,
Okay.
and TAPP stands for Transabdominal Preperitoneal Repair.
Okay.
Both of them are done laparoscopically,
Yeah.
meaning through tiny incisions in the abdomen,
Right.
but they approach the hernia from slightly different angles.
Okay, so both are minimally invasive,
Right.
but use slightly different pathways to access the hernia.
Yes.
Got it. But what if someone has already had both an anterior A&D, a posterior repair,
Yeah,
and the hernia has come back again? That seems like a really tough situation.
it definitely can be.
Yeah.
When both approaches have already been tried,
Okay.
it gets more complex.
Yeah.
But there are still options.
Okay.
We might consider an open preperitoneal repair,
Okay.
which is a more involved open surgery that gives us good access to the area.
So even in those challenging cases where it's recurred multiple times,
Yeah,
there are still surgical solutions.
there are.
That's reassuring.
It is.
But with all these different techniques,
Right.
is there any clear consensus on which one is the best?
That's the million-dollar question.
Right.
Unfortunately, there's no single best technique for everyone.
Yeah.
It really depends on the individual's specific anatomy,
Right.
medical history, and the surgeon's experience.
So it's all about finding the right approach for each individual case.
Exactly.
But is there any research that sheds light on which techniques might have advantages in certain areas?
Sure.
Like recovery time or long-term success?
Absolutely. While there may not be a universal best,
Okay.
studies do show that laparoscopic repairs tend to have some clear benefits for patients in terms of comfort and recovery.
Okay, that's good to know. What are some of the specific advantages of going laparoscopic?
Well, patients who have laparoscopic repairs
Mm-hmm.
often report less pain after surgery,
Okay.
have fewer wound infections,
Mm-hmm.
and tend to return to their normal activities faster.
So even if the recurrence rates are similar between laparoscopic and open repairs,
Yeah,
laparoscopic might be a better experience overall for the patient.
it can be.
Less pain, fewer complications, and a quicker recovery.
Right.
Those are big pluses.
Exactly. A large meta-analysis,
Oh, yeah.
which combined data from many different studies,
Mm-hmm.
found no significant difference in recurrence rates between laparoscopic and open repairs.
Okay.
But laparoscopic consistently showed advantages
Yeah.
in terms of pain management and reduced infections.
That's really compelling evidence in favor of laparoscopy.
It is.
So when making a decision about the second surgery,
Yeah.
it seems like patients should definitely discuss the laparoscopic option with their surgeon, even if their first repair was an open procedure.
I completely agree.
An open and honest conversation with your surgeon is crucial.
It is.
You need to understand the risks and benefits of each approach
Right.
and feel confident in the plan that's chosen for you.
Exactly.
Absolutely. Knowledge is power,
It is.
and being an informed patient is essential when facing any medical
I
decision.
agree.
But beyond just choosing the right surgery,
Right.
are there things people can do to prevent these hernias from recurring in the first place?
That's a great question.
Yeah.
And it brings up a really important point.
Yeah.
Prevention.
Yeah.
While we can't change our genetics,
Right.
there are definitely things we can do to minimize the risk of recurrence and even potentially prevent that first hernia from happening in the first place.
Okay, I'm all ears. What are some of the things people can do to stack the odds in their favor
Yeah.
when it comes to hernia prevention?
Well, maintaining a healthy weight is huge.
Boy.
Excess weight puts extra strain on the abdominal wall,
Right.
making hernias more likely.
Yeah,
So a balanced diet and regular exercise are key.
that makes sense. Anything else?
Quitting smoking is another big one.
Yeah, of course.
Smoking weakens the tissues in the body,
Yeah,
making them more prone to tearing
right.
and less likely to heal properly after surgery.
Okay, so healthy lifestyle choices.
Yes.
Weight management, no smoking.
Right.
Those are things people have control over.
Absolutely.
What about those who are already doing all the right things and
Yeah.
still end up with a hernia? Is there anything they can do to prevent it from coming back?
Even if you're doing everything right,
Yeah.
sometimes hernias just happen, but there's still steps you can take to minimize the risk of recurrence.
Okay.
For example, avoiding heavy lifting, especially after surgery, is important.
Right, you want to give those tissues time to heal properly.
Absolutely.
And I imagine proper lifting technique is key too.
It is.
Engaging your core and legs rather than putting all the strain on your back and abdomen.
Exactly. It's not just about avoiding heavy weights.
Yep.
It's about learning how to move your body safely
Right.
and protect your abdominal wall.
Yeah.
Physical therapy can be really helpful for this,
Yeah.
especially after surgery.
So there's a lot people can do proactively
Yes.
to minimize risk, both before and after surgery.
Absolutely.
But it sounds like there's still a lot we don't fully understand about why hernias happen
Right.
and why they come back.
Yeah.
What are some of the unanswered questions that researchers are still trying to unravel?
One of the biggest mysteries is why some people seem predisposed to hernias,
Okay.
even if they don't have any obvious risk factors. We know genetics plays a role,
Yeah.
but we're still uncovering the specific genes
All
involved
right.
and how they influence the strength and structure of connective tissues.
So there's more to the genetic component than we currently understand.
There is.
What other research frontiers are out there?
Another exciting area is the development of new biomaterials for hernia repair.
Okay.
Currently, we mainly use synthetic mesh,
Yeah.
but researchers are exploring natural materials that might integrate even better with the body's own tissues, potentially leading to faster healing and lower recurrence rates.
Wow, that's cutting edge stuff.
It is.
It sounds like the future of hernia treatment is moving towards even more personalized
It is.
and biologically compatible solutions.
Yes,
That's amazing.
it is.
But for now, it seems like choosing the right surgery for a recurrence,
Right.
finding a skilled surgeon, and making healthy lifestyle choices are the key takeaways.
Absolutely. Those are the main things we can control right now.
Yeah.
But research is constantly evolving.
Right. And new discoveries are being made all the time.
That's the beauty of science. There's always more to learn
It is.
and new possibilities to explore.
Exactly.
Okay, we've covered a lot of ground in this deep dive, from recurrence rates and risk factors to surgical techniques and prevention strategies.
Right.
But before we wrap things up,
Okay.
I think it would be helpful to recap the most important points for our listeners.
That's a great idea.
Yeah.
Let's distill all this information into some key takeaways
Okay.
that people can really remember and apply to their own lives.
Yeah.
First and foremost, remember that recurrence is a common challenge with inguinal hernias.
Right.
It's not a sign of failure,
Yeah.
but rather a reflection of the complexity of this condition.
Right. And there are so many factors involved.
There are.
From individual health and lifestyle to surgical techniques and surgeon experience. It's a multifaceted issue and not a one-size-fits-all situation. Exactly. And when it comes to choosing the right surgery the second time around, we talked about those two guiding principles,
Right.
mesh reinforcement and
Yeah.
operating in a pristine plane.
Right. Mesh is generally considered the gold standard for recurrent hernias.
Yes.
And finding that undisturbed tissue is key for a successful repair.
Absolutely.
And while there's no one-size-fits-all approach, research suggests that laparoscopic techniques might offer some advantages in terms of pain, infection rates,
Right.
and recovery time.
Exactly. It's all about having that open and honest conversation with your surgeon
Right.
to determine the best approach for your individual case.
So we've got the surgical side of things covered.
Yeah.
But what about prevention? Are there any key takeaways for listeners who want to minimize their risk of
Sure.
developing a hernia in the first place?
Yeah.
Or prevent a recurrence?
Absolutely. Maintaining a healthy weight through diet and exercise is crucial
Right.
for reducing strain on the abdominal wall.
Yeah.
Quitting smoking is also essential. Of
Versus smoking weakens tissues and impairs healing.
And even if you're doing everything right,
Yeah.
learning proper lifting techniques
Yes.
and avoiding heavy lifting, especially after surgery, can make a big difference.
Right. It's all about being mindful of how you move your body
Mm.
and protecting that abdominal wall.
This deep dive has been incredibly insightful.
It has.
We've learned so much about the complexities of recurrent inguinal hernias,
We have.
from the factors that contribute to them
Right?
to the latest surgical techniques and prevention strategies.
Yeah.
But before we wrap things up,
Okay.
I want to touch on one more thing that really struck me during our conversation.
Okay.
The future of hernia research. What are scientists focusing on now that could potentially change the way we approach hernias in the years to come?
That's a great question. There are some really exciting developments on the horizon.
Okay.
One area that researchers are delving into is the genetic component of hernias.
Okay.
We know that genetics plays a role.
But we're still uncovering the specific genes involved.
Right.
And how they influence the strength and structure of connective tissues.
So there's a lot more to learn about the genetic underpinnings of hernias.
Absolutely.
What else is on the research agenda?
Another fascinating area is the development of new biomaterials for hernia repair.
Okay.
Currently, synthetic mesh is the most common material used,
Yeah.
but researchers are exploring natural materials
Okay.
that might integrate even better with the body's own tissues.
Interesting.
The hope is that they could lead to even faster healing, lower recurrence rates,
Right.
and potentially fewer complications.
Wow, that sounds pretty groundbreaking.
It is.
What kind of benefits could these new biomaterials offer?
Well, like I said, faster healing, lower recurrence rates, fewer complications.
It's incredible to think about the potential advancements that could be just around the corner.
It is.
It seems like the future of hernia treatment is moving towards even more personalized and biologically compatible solutions.
Absolutely. It's a really exciting time to be in this field.
Right.
And I'm optimistic about what the future holds for hernia patients.
Well, I think we've covered just about everything there is to know about recurrent inguinal hernias.
I think so.
We've gone from the basics to the cutting edge.
We have.
And hopefully our listeners are feeling empowered with knowledge and a little bit more in awe of the incredible complexity of the human body.
It's been a pleasure diving deep into this topic with you.
Yeah, likewise.
Remember, knowledge is your greatest asset when it comes to your health.
Right.
Stay informed, ask questions, and be an active participant in your own care.
Couldn't agree more. And to our listeners, thank you for joining us on this fascinating journey into the world of recurrent inguinal hernias. We hope you found it informative, engaging, and maybe even a little bit inspiring. Until next time, stay curious.